would you recommend that people use these?
My understanding is that the kit is done by a laboratory which is certified. However, I take all this with a grain of salt because the information really needs to be interpreted correctly by a physician. Does it relate to the symptoms? Does it relate to a condition that needs to be treated? And it also skips the anatomic problems that can occur with the thyroid. So I sort of am concerned about giving a patient too much information without the background to understand what the significance of that information is.
Is it fair to say then, and we have had a lot of doctors here and we've had a lot of different physicians who have brought up the phrase Dr. Google, which is, it's interesting. We are at a time when we can become so intellectually brilliant on so many different subjects because we have it at our fingertips by the internet. Sometimes in this issue as well, you have to warn people. Just because you find it on the internet and just because you have a home testing kit doesn't immediately make it so that you've taken the doctor out of the mix.
I think that's a great point. When I speak to my patients and we're talking about surgery, I always caution them about reading too much on the computer, or as I say, the Reader's Digest, or calling Aunt Tilly and asking Aunt Tilly what to do. Patients should ask their physicians to explain things to them so that they understand and that they're not self-administering medications or other therapies which may be ultimately deleterious.